Hi, my name is Rochelle Hermanson, and this is my congestive heart failure PowerPoint. So what is congestive heart failure? Congestive heart failure is also known as heart failure, and it is a pathological condition where the heart cannot meet the demands of the body's blood supply. When the heart fails to produce enough blood supply, the kidneys receive less blood and therefore filter less. The extra fluid accumulates in the lungs, liver, eyes, and even in the legs. This congestion is what gives congestive heart failure its name. A lot of the time, a previous diagnosis correlates with CHF. Some common precursors are previous heart attack, high blood pressure, abnormal heart valves, heart muscle disease or inflammation, heart birth defects, lung disease, diabetes, and even sleep apnea. Another common factor is that it is one of the most common reasons that people above the age of 65 are admitted into the hospital. Currently, almost 6 million Americans have been diagnosed with congestive heart failure. So what happens to the body during CHF? Congestive heart failure often results in secondary problems along with organ shutdowns. According to the AHA, the American Heart Association, the heart attempts to adapt to this workload by enlarging, developing more muscle mass, and even pumping faster. The body attempts to accommodate by narrowing the blood vessels to keep blood pressure up and trying to make up for the heart's loss of power. The body diverts blood away from less important tissues and organs to maintain flow to the most vital organs, the heart and the brain. Eventually, the heart and body just can't keep up, and the person experiences the fatigue, breathing problems, or other symptoms that usually prompt a trip to the doctor. Heart failure can involve the heart's left side, right side, or even both sides. However, it usually affects the left side first. The term congestive heart failure is not what one would think. The heart does not fail, but moreover it weakens over time. I have heard it mentioned before that CHF is not a disease, but an underlying symptom of a result of another disease process. The effects on the body system can sometimes appear like a chain reaction. Fluid accumulates in the lungs and tissues, causing congestion. Decreased kidney function is a common issue seen in patients with CHF, which causes the body to retain fluids. The kidneys fail in that they lose their ability to excrete sodium and water. This in turn may cause swelling in the abdomen. The liver may also retain fluid, causing toxin buildup and lack of essential proteins. The intestines may be unable to process nutrients and medicines, and fluid buildup may be seen in the ankles, hands, and feet, resulting in edema. Taking back control. How do you do this? Well, overall, the prognosis for CHF is bleak. There is no cure. But if you catch it early on and take action, there is hope. On the National Library of Medication website, I found this, quote, "Often you can control heart failure by taking medicine, changing your lifestyle, and treating the condition that caused it. Heart failure can suddenly get worse, and these things are due to angina, lack of blood flow to the heart muscle, eating high salt foods, having a heart attack, infections or other illnesses, or not taking your medicines correctly, even such things as new abnormal heart rhythms. Most of the time, heart failure is a chronic illness that often gets worse over time. Some people develop severe heart failure. Medicines, other treatments, and surgery no longer help at this stage. And people with heart failure may be at risk for these dangerous heart rhythms. And these people will often receive an implanted defibrillator. Okay, that is the end of my presentation, and I hope you enjoyed it, and I'm sorry if I spoke too quickly.